Hi Gracie, my name is Danielle and I'll be your nurse today. I'm going to wash my hands. Gracie, can you tell me your last name?
Stevens.
How about your date of birth?
12/4/99.
Okay, and I'm checking that with the wristband and that is all correct. Gracie, do you know where you are?
At the hospital.
Okay, and do you know today's date?
December 12th, 2013.
Okay, and do you know who the president is?
Obama.
Okay, and what are you in here with today?
Chest pain.
Chest pain. What would you rate that pain at right now?
0.
Okay, and does this chest pain, is it constant? Does it come and go?
It comes and goes.
Okay, does anything make it better?
No.
How about does anything make it worse?
No.
No? Okay. And when did this pain start?
Last night.
Last night, okay. Well, we're going to be doing a full body assessment on you, so before we get started, do you have to use the restroom?
Yes.
Okay, I'll let you go do that. As Gracie is walking to the restroom, I'm going to be watching her gait. Her gait is normal. Patient is orientated to person, place, and time. Her speech is normal. Her general appearance is normal. Her skin is warm, dry, intact. The color is normal for her cultural background. Okay, Gracie, are you having any abdominal pain?
No.
No? Okay. Well, so first we'll start with your abdomen. I'm going to lift your legs up for comfort, cover for privacy. First, I'm going to inspect. I'm going to inspect for any discoloration of the stomach, any pulsations, any scars, any bulges of the stomach, anything like that. And you said you are not having pain in your stomach, correct?
Right.
Okay. So then first since her stomach is flat and it's symmetric, I am going to go on to auscultate. And since no pain, I'm going to start in the right lower quadrant. With the bell, active, or with the diaphragm, I'm sorry, active, right upper, active, left upper, active, and left lower quadrant, active. Okay, Gracie, now I'm going to palpate. If at any time this hurts, just let me know. While I'm palpating, I'm going to be watching Gracie's face for any grimacing. She shows no signs of grimacing. I'm feeling for any abnormalities, which I do not feel. Okay, Gracie, now I am going to palpate your stomach, okay?
Okay.
I mean, percuss your stomach. Tympanic, 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 tympanic. And once again, I would be starting in the right lower quadrant. Okay, Gracie, I'm going to elevate the head of your bed to 45 degrees. I am going to be looking at her jugular vein. Gracie, can you look to the left? I do not see any jugular vein distension, which is good. Okay, I'm going to auscultate her carotid arteries with the bell of my stethoscope, one at a time. Take a deep breath and hold. No worry noted. You can let it out. Take a deep breath and hold. No groups noted. Okay, now I'm going to start with the heart. I'm going to find the trachea, go down to the sternal notch, angle of Louis, and then I'm going to go to the right second intercostal space, which is the aortic. With the diaphragm, I'm going to listen. This is where I would be hearing S2 the loudest. I'm going to go straight across, second intercostal space. On the left, pulmonic. Third intercostal space, herbs. Fourth intercostal space, sternal border, fifth intercostal space, sternal border, tricuspid. And then left, fifth intercostal space, mid-clavicular line. That's her mitral valve, where I will be hearing S1 the loudest, and also the PMI is where I will feel the PMI. Okay? Okay, Gracie, now I am going to be doing your pulses. I am going to be starting with your temporal pulse. I will be doing all of these bilateral except the carotid. Temporal, plus 2, carotid, plus 2, carotid, plus 2, brachial, plus 2, radial, plus 2, ulnar, plus 2, femoral, plus 2, popliteal, plus 2, dorsal pedius, plus 2, posterior tibia, plus 2. While I'm down here, I'm going to be looking for any edema, which I do not note any. Skin is warm, dry, intact. Grading of edema, 0, none. I'm going to be checking capillary refill in the great toe, less than 3, which is normal. I'm going to cover patient up again. I'm going to check capillary refill in the top, less than 3, skin is warm, dry, intact. Gracie, can you hold your fingers like this, make the shape of a heart? I'm going to be looking for clubbing of the fingers. I see a space in there, so that's normal. Everything is good. Okay, Gracie, can you, let's see, can you sit for me, please? I'll have you sit right here.
Okay.
While Gracie is sitting, I'm going to be looking for her chest symmetry. It's normal, which is 1 to 2. When she's breathing, I don't see any retractions or use of accessory muscles. Let's see. Okay, Gracie, I'm going to feel for your PMI. While I do this, I'm going to have you give yourself a bear hug and bend forward. I'm going to start at the left mid-clavicular line, 5th intercostal space. No heave or thrill. Thank you. Now I'm going to auscultate 4 pairs anterior, 2 lateral, 6 posterior. You can breathe in through your nose, out through your mouth. If at any time you feel lightheaded or dizzy or you need a break, just let me know. I'll start with the diaphragm and above the clavicle. 4 pairs. Now I'm going to do 2 lateral. I'll help you put your hands to your side. In through your nose, out through your mouth. Okay, I'll have you turn a little further, please. Thank you. Now I'm going to do the 6 pairs in the back. C3. Okay, in through your nose, out through your mouth. Okay, I do not hear any adventitious breath sounds. Her breathing is non-labored and it's even. Gracie, now I'm going to be doing egophony. Each time you feel me put the stethoscope on your back, will you say E for me?
Yeah.
E. 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 Okay, this is negative egophony. I can hear it. I can hear E. It diminishes as I go down the back. Now I'm going to do tactile fremitus. Each time you feel my hands on your back, will you say 99?
Yep. 99. 99. 99. 99. 99. 99. 99.
Okay. Tactile fremitus is negative. I feel vibrations as I go down the back, and then as I go down further, it diminishes. Okay, now I'm going to percuss with my wrist stroking motion. Resonance, 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 resonance. Okay, Gracie, can I have you turn this way a little? Right now I'm going to do chest expansion, go down to T9, T10. Push my thumbs together like I'm pinching the skin. Ask the patient to take a deep breath in and let it out. Good. Chest expansion is even. Okay, Gracie, you can look at me, and I'm going to do your pupils. You can just keep looking at me. Good. Can you look at the picture on the wall? And now look at my pen light. Good. Okay, pupils, I checked. They are size 3. They're round, and they are reactive to light. Okay, Gracie, now I am going to be doing your motor reflexes, okay? I will grab my hammer. And for the upper, I decided to do the tricep. Let your arm hang like it's dead. Ready? +5. Let it hang like it's dead. +5. Then for the lower extremity, I decided to do the patella, and these were normal; they'd be +2. So lower extremity, feel for the tendon, +2. Feel for the tendon, +2. Okay, that's all normal. +2 on the upper, +2 on the lower. Now we are going to do the motor reflexes. Those were the deep tendon. Okay, so I'm going to have you put your hands like this. Push towards me. Push back. Put your hands like this. Push down. Push up. Good. Can you squeeze my fingers as hard as you can? Good. So those are all +5. Now I'm going to do the lower extremities. Your foot, push down, +5. Push up, +5. Your legs push back, +5. Push forward, +5. Now I'm going to do the plantar flex. Can I see the bottom of your foot, please? Normal finding is inversion of the toes. Gracie, is there anything else I can do for you today?
No.
No, thank you. I would wash my hands and leave the patient's room.